The Organization for Economic Cooperation and Development report, moving forward to be referred to as the OECD report, is a comprehensive collection of data that aims to standardize and decipher healthcare globally. Key aspects of the report include health status, risk factors for health, access to care, quality of care, and health system capacity and resources. The OECD report takes into account countries with similar income levels and spending and allows direct comparison of how healthcare dollars in each country are translating to quality of care. The United States has devoted an astronomical proportion of our gross domestic product, already the highest in the world, to healthcare. Are we spending more for higher quality care and better outcomes? The unsurprising result of the OECD report is that no, we are spending more only to receive comparatively suboptimal care. I will repeat, in the US, we are spending more money on our health and only getting sicker and dying sooner than those in other OECD countries. US overspending in healthcare is an issue that is not unique to the interests of Democrats or Republicans. The problem we face is that there are competing partisan views on how to effectively make change. For example, one of the fundamental differences of US healthcare is our multi-payer system and high administrative costs that support that system. Despite the fact that administrative costs in the US are 5 times the average of other OECD countries, partisan opinion on our multi-payer system varies significantly, and we appear to be at an impasse regarding making a change in our underlying payer structure for the time being. Fortunately, there are other opportunities presented in the OECD report that can be used to create meaningful change in our healthcare pricing with bipartisan support. As an example, Germany and France have similarly high economy-wide pricing as the US does, but less expensive healthcare pricing. Data from the OECD indicates that policy decisions to regulate lower healthcare prices in these countries have led to significantly lower healthcare costs. In 2023, the Lower Costs, More Transparency Act was passed in the House of Representatives with strong bipartisan support. This bill addresses price transparency for services rendered at hospitals, outpatient labs, and ambulatory surgical centers, as well as prices for prescription drugs. While the bill currently awaits approval through the Senate, it clearly demonstrates the usefulness of the OECD report to inform U.S. healthcare policy decisions with the goal of decreasing overall healthcare spending. Current OECD projections for the next 10 years place the United States spending over 20% of the GDP on healthcare, but without change, this will continue to reflect excessive spending without benefit. We must continue to utilize this comparison data in the OECD report to find solutions to our high healthcare costs relative to actual services rendered.